proposed trans policies. According to a Freedom of Information request, your office received thousands of letters in the weeks following your proposed announcements. Those in support thanked you for protecting the rights of parents and children, calling it common sense, but there was also significant concern. Some called on you to rescind the policies. Others expressed concerns about consultation, government involvement in medical decisions, misinformations, and the safety and well-being of LGBTQ2S+ Albertans. In over 2 weeks, your office received over 12,000 letters titled "Protect Students, Withdraw the Regressive Policy," yet you have said several times that you believe Albertans support these policies. What are you basing that belief on?
Look, I mean, we are going to make sure that any individual who is transitioning is supported. That was the starting point, is that I'm concerned that there are gaps in the medical coverage, that we don't have the surgeries available here, we don't have proper surgical aftercare, and that there are sometimes difficulties getting the lifelong medical support needed to be able to support somebody who's on hormone therapy. And then the question was, at what point should these decisions be made? And I must tell you, the developing international evidence is that there's no consensus on this. What we're seeing, if you saw in the UK, their National Health Service just announced that they will not be offering puberty blockers to young people under the age of 18 because they feel that the potential risks and harms have not been studied, and that the risk is too great. So when we look at that, we have to look at the broader international picture and see what the evolving evidence is. The UK, many of the Nordic countries, they're taking a different approach. We want to be cautious. We want to make sure that children are making these decisions when they're old enough to understand the consequences, because we are talking about sterility. Let's be frank about it. If you stop the process of puberty and then you do cross-sex hormones and you don't become sexually mature, you can't have children. And so we have to decide at what age a child should make that decision. And from the feedback that we've gotten from those who are in the field, from looking at the international evidence, we just don't feel comfortable that that would be the age 15 and under. We have agreed that we believe that children who have good medical care, psychological support, and supportive family can start that when they're 16. And I think that increasingly is going to be supported by the international evidence.
You mentioned the international evidence, but how do you know that this is what Albertans want? And on that note, would you commit to polling Albertans to find out if they do, in fact, support these policies and release those findings? Well,
look, when you're talking about lifelong decisions about whether or not a person is going to take an action that's going to result in their sterility and they're a child, I think there comes a point where you do have to be looking at what the international evidence shows. And if we're seeing in other jurisdictions that there's concern about the long-term impact of puberty blockers, and there's concern about prematurely having young people make these decisions, then I think we have to be mindful of that. Our job is to make sure that kids can make adult decisions as adults, and that they don't end up making a decision prematurely that will cut off their choices.